Welcome to the Beauty Equation podcast, where beauty meets biology, psychology, and art history. This podcast is hosted by myself, Dr. Christelle Oliver-Dussault, Dr. Harpreet Lotay, and a beauty industry expert, Amanda Manholt. This is your space to reclaim agency over aging and beauty on your terms. We're cutting through the noise with evidence-based insights and real talk about aging, self-perception, and modern treatments. No quick fixes, no fluff. Just honest conversations to empower you to define beauty for yourself.
Welcome to the Beauty Equation podcast. I'm Amanda Manholt, and I'm here with my co-host, Dr. Oliver-Dussault.
Hello, everyone.
And the lovely Dr. Harpreet Lotay.
Hello, hello.
And today we're going to delve a little deeper into bioregenerative injectables and talk about Sculptra, which has been very exciting, and we've seen a lot of great results from this product. So without further ado, let's talk about Sculptra and why we think it's pretty fantastic for some people.
Yes. Well, maybe we should start with saying what it is.
Polylactic acid. Am I saying it right?
Yeah, L-poly.
L-poly something or other.
Yes, polylactic acid.
Yeah, it's
There
that.
you go. PLLA. The acronyms are always easy to remember.
So much easier. And if you want to know what it looks like when we get it, it comes in these lovely little vials with a little sort of a powder in here, and it is reconstituted into a liquid.
Yeah. And it is essentially absorbable sutures broken down into a powder form. So many of you who've had cuts before, we will use absorbable sutures and they break down naturally in your body, but they also act as a scaffold, and that's the principle behind it, of acting like a scaffold. But there's different applications and caveats for the use of Sculptra. I might let you, Harpreet, talk about how you select a patient for Sculptra.
Sure.
Because the benefits of a treatment are often in the right treatment for the right patient.
Yeah, and I think that holds for most treatments. Patient selection is everything. So not everything is perfect for you, even if it was perfect for your friend, right? So definitely I can talk about that, and also just touch on the history of Sculptra, because it's not something that's new. It's been around for I want to say like 30 years, maybe a long time. And it actually came to the market in response to the thinness and basically weight loss that we saw in patients with HIV/AIDS. So patients with that would get very, very skinny, and they would get so thin in the face, they would look quite sick. And this injectable really helped restore some of their the volume in their face and just made their life that much easier. And then it went on to be used in aesthetic patients. And I would say it sort of fell out of favor a little bit because hyaluronic acid-based fillers were in the market and gave you immediate results. And Sculptra doesn't work that way. So when we look at patients who Sculptra is good for, it's good for people who are patient. It's for the patient. So it's great for people who want to do something to improve their collagen and give them a bit of plumpness and volume over time, wherein they don't want people to know what they've done. They may not want their partner to know what they've done. And it will give them gradual, slow improvement over a 6 to 9 to 18-month period. So it's long. It is not a one-time treatment, so it's good for people who are going to see us on a more continual basis, at least come to see us 3 times. It is also, I find, good for people who are very slim.
Yeah, I love it in runners.
Yes.
It's such a nice treatment in runners because they're so fit. And oftentimes I find like they eventually will have a disconnect between their body and their face because they lose so much volume in their face, and it just ends up rebalancing them so naturally.
Yeah. And the other patient category is people with rapid weight loss, people who are on GLP-1s. Interesting data with GLP-1s now, we're seeing that people will lose weight, but it seems like they're face loses volume maybe a little bit disproportionately. And the data's out on that, but we do see a lot of volume loss in people's faces when they go on GLP-1s. So that's another patient population that Sculptra is great for.
Yeah.
And who is it not good for? Because there is a contraindication for sure.
So
Mhm.
I think if you have a history of any autoimmune disease, because it is working through an inflammatory pathway, and when there's any form of autoimmune disease, we don't know how your immune system will react to that inflammation. We don't have control of it. So it's safer to use another treatment option if
Yeah.
that is your concern.
Safe to say we don't know if your immune system would know to shut off, right?
Yeah. So will it
Exactly.
overreact? Will it underreact?
Yeah.
We just don't know.
It's hard to predict. And I think that's something that's worth mentioning too with any of the bioregenerative treatments. We're all human beings and our own little organisms. So, to your point about it was good for my friend, it doesn't necessarily mean it's good for me. Like results will vary on from one person to the next,
Yeah.
right?
Yeah,
Based on
absolutely.
how healthy they are, their diet,
Mhm.
their lifestyle.
Mhm.
Yeah.
Are they baking in the sun and smoking a pack a day? I mean, you're going to see different.
Yeah.
Mhm.
What you fuel your body with, particularly when you're using these treatments that harness your own physiology, your own cellular mechanisms, that fuel will have a huge impact on the result.
Yeah, getting enough sleep, all of those things, right?
Protein intake. So going back to our GLP-1 patients, if they're not able to eat enough,
Mhm.
they may not get the full result,
Yeah.
right?
Hmm.
And if the GLP is very, very anti-inflammatory for them, maybe another treatment is something we need to think about. So there's a
Yes.
few things to consider for sure.
Yeah. But to your point about, slimmer patients, it really is lovely because I think oftentimes those patients that are quite slim worry that they're going to look, puffy or weird with a traditional filler.
Mhm.
And while that may or may not be the case, I think psychologically that this feels better to a lot of them because
Mhm.
they don't feel like they're going to look like a chipmunk or unlike themselves.
Yeah.
Yeah,
It has a
exactly.
beautiful impact on the quality of the skin too.
Mhm.
Like
Absolutely.
you can kind of spot them when they walk into the door. There's just a bit more reflection to the skin,
Y-
that glow that you just can't put your finger on.
Yeah,
And that's what a lot of people will tell us too when they come back.
for sure. And I feel like, when you've done a treatment and then they're back for their second one in 4 weeks, it's pretty cool because even at that point, I feel like you're
You
starting
can,
to
yeah.
see that.
Hmm.
Yeah. It's the collagen. So collagen is white.
Hmm.
So as we get more collagen within our skin, you see more reflection, right? The light will bounce off that white structure in the skin. It's kind of cool.
Yeah, it's as you've said before, it's the why when you look at little children,
You know.
they have that luminosity to them,
Mhm.
Like, where are you going? The sandbox with those
I
perfect lips and long
I know.
eyelashes, little boy? It's
Aw,
always the boys that get the eyelashes. I
I
don't
know.
know.
It's so not fair.
Yeah, so a Sculptra again is a really great treatment
Mhm.
for anybody that's looking for a global improvement
Mhm.
to
Mhm.
the skin, collagen, sort of a general tightening is I
Mhm.
think it's
Yeah.
fair to say as the skin becomes more robust.
Yeah.
Yeah.
You would come and see us once a week.
Oh,
Sorry, once a month,
once
pardon
a
me.
month or
Can you imagine
even
once a
every
week?
so
That'd be a
often.
bit intense.
That'd be a bit
I'd
much.
love for
Sorry.
you to come see us once a week
Once a
for other
month.
Or
stuff.
come to see us to say hello.
Yeah.
Yeah.
Between 4 to 6 weeks.
Yeah.
Can you talk a little bit about off label, on label, like places that it's used? Because I know that there are some clinics, we don't really do it here, but they're using large volumes of it
Yeah.
for people's bottoms.
Yeah, you can do it for an injectable BBL. You can use it on the body for laxity in the abdomen. Some people will use it in necks. The dilutions are a bit different, but it can be used in many, many different places. It just touching on post care, it does need to be massaged. So wherever we put it, you need to be able to massage it well 5 times a day for 5 minutes for 5 days.
See, I can remember that.
Yeah, easy one.
So,
And it's very common to because there's a lot of fluid going in to find that You might even look puffy leaving, or you're happy with the level of puffiness, and then you wake up the next day and you're like, "Where did it all go?"
Yeah. Yeah.
That's normal. And the other thing to expect sometimes bruising. So whenever you're injecting your face, expect bruising. But overall, not really much downtime, and it's not a procedure that takes that long either.
No,
Yeah.
no. Yeah, it's a I feel like all of our patients have tolerated it quite well and haven't been dreading their subsequent treatments, They're
Mhm.
more excited to come for their second and third round.
Yeah.
Yeah.
And then in terms of, the length of time that those results are lasting, are we, I think the studies were saying 2 years?
Yeah, 18 months generally, people will come back and need or want. Need is a strong word. Will want
Yeah, want.
another treatment, and people often will ask, "Well, how long does this last?" Well, you're making collagen. It will last as long as your native collagen would last. So it really is dependent on how fast you're sort of eating up that collagen. So again,
Mhm.
lifestyle factors and genetics come into play yet again.
Mhm.
So, but generally speaking, 18 months. So most people don't need the first sort of 3 loading dose kind of treatments. When they come in at the 18 months, it's one session.
Mhm.
Mhm.
Yeah. Great. I can't think of anything else to ask or talk about in terms of Sculptra other than come on in.
Mhm.
Well, we can talk about what they might hear on social media, especially the plastic surgeons have been some of
Oh,
them,
yes.
right?
Yeah, yeah.
Saying, don't get Sculptra, you'll never be able to have a facelift. And for some people, that's just fine.
Mhm.
But there's controversies around that. So the way that Sculptra works, as we said, is to create collagen within your tissues. And some plastic surgeons do feel that that collagen that's created will actually adhere or join tissue layers together. And some of them feel like it might make facelifts harder. And having said that, we also have plastic surgeons who use Sculptra and feel like
Mhm.
it's no problem. They just adjust their surgery schedule and don't do surgery on people who've had it within 18 months. So,
Mhm.
generally speaking, if you come to us and you say, I don't have a problem with a facelift, in fact, I'm thinking of having one in the next year, we might steer you away from Sculptra. However, many surgeons also say, you know what? I do surgery in people who've had car accidents or other scarring events all the time, and it's really a testament to my surgical skill, which I would they would argue every surgeon would have to be able to deal with all kinds of patients, patients who have
Mhm.
very smooth, slippery tissue and patients where there needs to be a little bit more work and care taken to do the surgery. So, um, that's the controversy around that.
Mhm.
Yeah. I find that to me, it makes sense to have a treatment that's going to address the quality of the tissue
Mhm.
because a facelift is just pulling that canvas.
Yeah.
And you're not addressing what is actually happening in terms of aging. And in combination, it's a good option because at some stage you may need some degree of pulling,
Mhm.
but you're better to pull healthier skin or skin that has thickened than very thin, friable skin.
Yeah. So
I think good skin looks good on anybody no matter what,
it's always a good investment, whether you're going to have surgery or not,
Mhm.
taking care of your skin and using all your tools, lasers, microneedling,
Skincare.
all that. Yeah.
Sunscreen. Let's not forget the sunscreen.
Of
I
course.
know.
Yeah.
Everybody rolls their eyes,
I
but
think
I'm
it's
like,
like the best thing. Like it's the best thing you can do.
100% it is.
Yeah.
It's just not sexy
Nope.
or like marketing
It'll
fun.
keep you sexy. Keep using it. That's what I
That's
say.
That's right. That and my estrogen
And
patch.
yeah, right. A lot of people don't know UV damage also accelerates the volume loss in your face. So it's just good all round, not just even for the topical skin.
Yeah.
Absolutely. So, Sculptra, anybody that is feeling like their skin is getting a little thin or weak or non reflective, devitalized, I'm trying to think of other words.
You're
Or if you're
noticing your
starting
accordion lines,
yes,
like
the
when you
accordion lines.
smile, it works great on those types of patients.
Yeah, because you can't Botox them or they'll look like they had a stroke.
Won't work
Right? Or
either.
or it won't work. Yeah, more importantly, and you're not going to add a bunch of volume in the lower face. What you want is you know, nice, stretchy, bouncy, resilient skin.
Exactly.
Yes.
Yeah, a lot of women are bothered by that. So those accordion lines is a name for them. But if you think about if someone smiles big, and if you look at a picture of you from the side, you've got, your smile, but then in behind, you've got like the waves kind of
Yeah.
in behind,
Yeah.
right?
Yeah.
Um,
It works really well for that.
and again, you often see that on those slimmer women,
Yeah.
right? So great for that. Typically done in a series of 3 treatments a month apart, and downtime is not
No, not significant.
not really significant.
No, not
It's
much at all.
popular for a reason.
And the thing I love about it too is, like you said, it's been around for a very, very long time.
It has.
Um, I think I would assume that that's one thing as physicians that gives you some comfort when you're doing things. Because let's face it, these are elective procedures. We're not saving anybody's life. So
Yeah.
it
Yeah,
must make you feel better to know that it's tried and tested.
Yes.
Yeah, exactly. So we're going to be talking about another product that's been around for a long time on our next episode, and that is Radius or calcium hydroxyapatite. And there's a newer calcium hydroxyapatite product on the market now in North America. It's been in South America for a while, and tune in to hear all about that new option available to you on our next episode.
So if you enjoyed today's episode, make sure you
Please like and subscribe.
so you don't miss an episode.
Thanks so much for hanging out with us. Bye for now.
Bye for now. Before we wrap up, just a quick reminder. While we're medical professionals, everything shared on the Beauty Equation is for informational purposes only and isn't intended as medical advice. This podcast doesn't establish a doctor-patient relationship, and any medical or aesthetic decision should always be made with a qualified healthcare provider. Our views are our own and don't necessarily reflect those of our employers or affiliated organizations. And remember, the field of aesthetics is always evolving, so information may change over time. See you next time on The Beauty Equation.
Thank you for tuning in today. If you enjoyed today's episode, don't forget to like, comment, and share it with someone who might need to hear it too. We'd love to hear your thoughts or questions. You can send us an email at info@thebeautyequation.com, and you might hear your question answered in future episodes. You can also find us on Instagram at Dr. Christelle MD, at Lotay MD, and at Crow's Feet and Confidence. Until next time, keep questioning the equation.